Yeah, I'm Nico Marx. I'm professor of medicine and cardiology and head of the Department of Cardiology at the University of Aachen in Germany. Carolina was a randomized controlled clinical trial designed to compare the effects of linagliptin with glimepiride on cardiovascular events. It enrolled about 6,000 patients with early type 2 diabetes and elevated cardiovascular risk. Median duration was 6.3 years of diabetes, and about 40% had established cardiovascular disease. And over a median follow-up of 6.3 years, we showed that the use of linagliptin compared with glimepiride resulted in a non-inferior risk of a composite cardiovascular outcome, including 3-point MACE, but also including all-cause mortality and cardiovascular mortality, as well as non-cardiovascular mortality. In chronic diseases, analyzing all events, meaning first event and recurrent events, gives a more complete picture of disease burden on the one hand, and on the other hand, on the safety of the therapies investigated. And that's why we aim to characterize the effects of linagliptin on net cardiovascular events and hospitalization burden in the Carolina study population. Well, we use sulfonylureas as glucose-lowering agents for more than 50 years now, but they bear the risk of hypoglycemia and weight gain. But probably more important, in a very early study published in the late 60s, UGDP showed that tolbutamide, an early SU, increased cardiovascular death in patients with diabetes. It has to be said that this study included a small number of patients, a small number of events, but subsequently, all sulfonylureas approved for use in the US carry a warning in product labels about potential increased risk of cardiovascular mortality. And given that in the Carmelina trial, we showed that linagliptin versus placebo does not increase cardiovascular risk, Carolina also provided an answer on the safety of a modern sulfonylurea, in this case, glimepiride. We analyzed the effects of linagliptin versus glimepiride on all first plus recurrent event for 3-point MACE, 4-point MACE, fatal non-fatal myocardial infarction, fatal non-fatal stroke, as well as heart failure hospitalization or heart failure death, and any hospitalization that occurred during the trial. Time to first events were analyzed using Cox proportional hazard models with risk estimates reported as hazard ratio, and negative binomial models were used for analysis of all events with risk estimates reported as risk rate ratios. Important to mention that all p-values presented are nominal and not adjusted for multiple testing. The main finding is that by including recurrent events for the present analysis, the number of events increased from first events by 10 to 77% across cardiovascular heart failure outcomes, and by 116% for all-cause mortality, all-cause hospitalization. The main increase in events looking at recurrent events was in heart failure hospitalization, as well as all-cause hospitalization. That was the first finding. The second main finding was that there's no significant difference between linagliptin and glimepiride for either first or recurrent cardiovascular or events or hospitalization in patients with type 2 diabetes. There are basically two conclusions. One conclusion is that these data underscore the significant cardiovascular disease burden experienced by patients in this trial. This is a population with early type 2 diabetes and elevated cardiovascular risk, and the inclusion of recurrent events showed that in particular heart failure associated events as well as all-cause hospitalization is a recurrent event in this population. And the second main conclusion is that these data reinforce the safety of linagliptin in this population. But the first take-home message is, even in a population with early type 2 diabetes, be aware of the fact that this is a high-risk population for not only first but also recurrent events. So if someone had an event, there's a high likelihood to experience a second and maybe a third event, in particular heart failure hospitalization or all-cause hospitalization. And the second take-home message is that in this analysis, the safety of linagliptin, but also glimepiride, is confirmed.